Hello and welcome to this short video, Foodborne Viruses. My name's Andy Bowles and I'm a food lawyer. Now this is the 25th out of a series of 100 short videos that I'm recording on UK food law topics. Now you may be watching this as part of our online training service, where if you are, then you'll be able to download a lot more information about the sort of issues I'm raising in this video. You'll also be able to watch an hour-long webinar if that's what you want to do, where you'll get a lot more, again, detail about the topic. Okay, you may be watching this, of course, on a YouTube channel, in which case you're very welcome. So, foodborne viruses. The most common foodborne viruses are norovirus, rotavirus, hepatitis A and hepatitis E. Now that is sort of in descending order because the most prevalent of the foodborne viruses would be by a country mile norovirus. Hepatitis E is sort of an emerging pathogen. In other words, it's sort of something that's occurring, we're finding more and more, and we are talking about foodborne disease here. Hepatitis A does occur in quite low levels in England and Wales, typically associated with consumption of contaminated shellfish. And rotavirus, well, it is another virus very similar to norovirus, but doesn't occur in such huge numbers. So what sort of numbers are we talking about? Well, the cases of norovirus in England and Wales per year probably run into the millions, of which, however, the Food Standards Agency estimates that around 380,000 per year in England and Wales can be attributed to food. So in other words, consumption of contaminated food. Now, viruses don't grow on food, so we're talking about contamination of food, most likely through food handlers who themselves are suffering symptoms of norovirus or one of the viruses, or through maybe contaminated water or contaminated equipment or so forth. Now, norovirus, I said 380,000 cases estimated. The reason why it's all estimated, all a bit vague, is because of the nature of the infection. Typically, someone suffering from norovirus will get some acute, in other words, very quick symptoms occurring instantaneously. In other words, you'll suddenly feel unwell, maybe nausea, vomiting, diarrhea. There could be some fever associated with it, and you may feel very, very, very ill, but actually lasts a very short time. Within a day or two, you're back to normal. So most healthy adults would be only affected very marginally by norovirus. They wouldn't actually have any ongoing issues. Of course, with more vulnerable groups, such as the elderly, infection can be much more serious. So with norovirus, because most healthy people who contract norovirus are ill very quickly, but then they recover very quickly, most don't bother going to the doctor. They don't go to the GP. So when we're talking about the 380,000 cases, we're looking at those cases that people have been ill enough to think that they have something seriously wrong with them, that they actually drag themselves to the doctors. The doctor actually initiates an investigation, including a laboratory investigation into their feces, and they identify viral particles. As you can see, that would only occur in a very small number of cases because most people just won't feel well enough to go to the doctor, and as soon as they feel well enough to go to the doctor, they actually feel, well, they don't need to go to the doctor anymore. So that's the nature of it. Norovirus is spread very easily. Only a few viral particles can cause infection. So I said person-to-person spread is probably the number one issue here. If you're present where somebody vomits who has norovirus, or if you're sharing a house, sharing towels and things like that with someone who has the virus, then the likelihood is you're going to get it as well. Of course, this can be of real concern in places like care homes where you've got elderly residents living in very confined spaces with, access to not necessarily being able to isolate people who become ill. It's also an issue on enclosed spaces like in cruise ships and things like that, where there have been some well-documented big norovirus outbreaks, because it's just very difficult to control once it's out there. In terms of norovirus, A lot of cases, the foodborne ones, so of the 380,000 cases a year in England and Wales, approximately a third are associated with takeaways. So again, this is where an investigation has been carried out. An environmental health officer has visited people or talked to them on the phone and gathered a questionnaire asking where people have eaten, what they've eaten, how long ago they've eaten, and so forth. And they've come to the conclusion that it was maybe takeaway food that has led to the infection. Why would takeaway food lead to infection? Well, typically because of poor handling at the food premises. So if you're running a food business, you need to make sure that your food handlers, if they're ill, are actually removed from handling food. Now, it's a fitness to work issue. There's a separate video on fitness to work, but it's not rocket science. What you don't want is somebody who's a food handler who is running off to be sick or running off to the toilet for other reasons and then coming back to handle food. Because if they don't have scrupulous hand washing in between, there is a good chance they'll pass on the norovirus particles through the food or through to other people in the environment. So norovirus is quite difficult to control. Hepatitis A is a significant virus in terms of infection. It can cause quite severe symptoms, including jaundice, but it's of less significance in terms of frequency. We have much fewer cases of hepatitis A in England and Wales than we would of norovirus or rotavirus, which is very similar to norovirus. Common sources of viruses. Bivalve mollusks, what do I mean by that? Shellfish. Live bivalve mollusks would be things like oysters, mussels, clams, things of that nature, of which oysters would be of perhaps the highest risk because viruses are easily killed by heat treatment. However, people don't heat treat oysters, do they? They eat them. So what are the controls for oysters? Well, basically, oysters, like all live bivalve mollusks, must be grown in pure or clear classified waters. So the seawater they're grown in is monitored. They use bacterial indicators for monitoring rather than viruses, but they're looking for things like E. coli and stuff like that in the water. So they have to be harvested only from properly classified waters. But because most seawater is not really up to that sort of highest level, what they call a Class A water, the vast majority of oysters, once they've been harvested, will go through an artificial purification process inland. This is where they're put into big tanks of seawater. The seawater is purified by UV light. The oysters are encouraged to filter feed. And what they do is they bring in the clean, pure water and they sort of, pass on any contaminants. They let go of any contaminants, including virus particles, into the tanks, then they get rid of it. So it's just a way of trying to cleanse the oysters prior to human consumption. So that means whilst there is an association between norovirus infection and consumption of oysters, it is actually, in real terms, quite low. It's still an issue, but it's low. Things like berry fruit, things like raspberries, for example, could be vectors of norovirus infection. If you look at raspberry, when you think about it, if you've got some virus particles onto a raspberry, how would you get them off? The consumer isn't going to scrub a raspberry with a nail brush, is it? Because there's not really anything left. So washing raspberries is very difficult. So the control for virus infection for things like berry fruits, like raspberries, is having proper hygiene controls at primary production. There's a video on primary production if you're interested in that. In other words, having potable, drinkable water used to irrigate raspberries and making sure the same health rules apply to members of staff. So anyone who's out there picking the fruit or doing what, working in contact with the fruit needs to be fit to work. You want to exclude anyone who has been either ill or has recently been ill with things like vomiting, diarrhea in particular. So leafy green vegetables are another one, things like lettuces. I think the Food Standards Agency identified that a significant proportion of norovirus, foodborne norovirus infections came from lettuces. Now, they did qualify that by saying, look, whilst it's quite a high percentage, in real terms, you'd have to eat something like 15,000 lettuces to be exposed to norovirus on average. It's still, there is an association there. So we are again talking about food handlers, probably poor quality water. Pigs and pork products can be associated with viruses as well. But actually, the most common source of viruses is going to be food handlers. I made that point. People handling food in a restaurant, in a takeaway, or anywhere from primary production onwards, if that member of staff is infected with something as easily transmissible as norovirus, then the likelihood is they will pass it on. So it's key to have very clear fitness to work rules in place to control viruses. So the sort of management controls, making sure, first of all, hand washing. We know that through the pandemic, hand washing is key. Not just hand washing, but really effective. If people are handling food, ready to eat foods, they should be washing their hands properly and drying them properly. Fitness to work, I keep mentioning that because that is absolutely crucial in virus control. If someone is unwell, they should not be working with food. If they have vomited, have diarrhea, they should definitely not be. And that is a legal requirement. They should be removed. Cleaning and disinfection is important, particularly what I'm rather nicely putting as incident management. So if you're running a restaurant and, I don't know, someone throws up in your restaurant, you need to have a process where you can safely remove the vomit from wherever it's occurred. I mean, this is really important. Having an antiviral cleaning kit in public places can be really important in trying to control things like norovirus. But it's also training and awareness of all the above, making sure staff know that if they are unwell, they must report to their supervisor, making sure that if they see a member of the public being sick somewhere, that they activate the antiviral process to prevent spread in that restaurant to the staff, to the customers, or on any food. If you've got things like salad bars, you need to make sure you take precautionary measures, stop people possibly, dripping into food or contaminating food themselves. You get the idea. So management controls for berry, fruit and leafy vegetables, I mentioned they are a vector of the disease. Irrigation, making sure water is clean and fresh, making sure the ice used for packing foods is also properly potable. So water management is key. Anyway, thank you very much for listening to this video. That's 1 out of 100. There are 99 more to watch, so please join me on the next one. Thanks for listening.